All right, everybody, welcome back to the Cabral Concept. Can't wait to get into today's topic. So many people dealing with bloating and gas, skin rashes, brain fog, and overall kind of sluggishness, and not knowing, not necessarily suspecting that it can actually be from fungal-based overgrowth. So if you're someone that's used birth control in the past or antibiotics, even as a child, I'll go into all the different reasons as to why you may got it, but this is really important that you stay focused on this because oftentimes it's overlooked because doctors are testing for SIBO, small intestinal bacterial overgrowth, which is oftentimes confused with or overlooked instead of SIFO, which is small intestinal fungal overgrowth. Now, I will say you'll oftentimes see them coincide in a practice, and they're typically treated or worked on the same exact way. So the good news is that if you're working on one, you're typically working on the other the same way if you're working with an integrative health practitioner. However, if you're working with a pharmaceutical-based doctor and they give you pharmaceuticals, the pharmaceuticals they give you for SIBO are not going to touch the ones for SIFO, small intestinal fungal overgrowth. So why does all of this matter? Because your gut microbiome is literally your body's ability to absorb nutrients from all the food that you eat and then eliminate the waste that your body's not going to use. And when it becomes imbalanced in any way, there's also a large amount of inflammation inside the intestines that are given off. That could lead to constipation, it could lead to loose stool, but it can also lead to increased intestinal permeability, which both SIFO and SIBO can do. That then can lead to a spilling out of proteins or bacteria or pathogens into the bloodstream, increasing lipopolysaccharides as well, then causing autoimmune disorders as well. So there's a lot to this. It's so important. All of this can cause high blood pressure, high cholesterol, type 2 diabetes, dementia, and more. That is why we need to stay focused on the gut. So again, if you're someone who's been dealing with digestive disorders such as cramping, bloating, gas, constipation, loose stool, and with candida and yeast overgrowth, it is oftentimes more towards the constipation or the sluggishness. If you've been dealing with fatigue or brain fog, sugar cravings, malabsorption where you feel like you're eating but you're just not absorbing the nutrients, if you have a white coating on your tongue, now again, you don't need all of these, but these are hallmark signs of a fungal or yeast-based overgrowth, as well as joint pain or skin rashes. It's crazy, but when I talk about this list, this is literally everything I had when I was 17 years old and really going on for 5 or 6 plus years. And that is because I had been taking antibiotics from ages 14 on through 17. That means I took over 3,000 capsules of amoxicillin before my 18th birthday. And so when you think about that, think of the destruction that would cause to your gut microbiome. Because antibiotics, yes, they're killing bad bacteria, and I was put on them by a dermatologist for skin-based issues, but they're also wiping out a lot of the good bacteria. And as they're wiping out a lot of the good bacteria in your gut microbiome, your intestines, it is allowing then for yeast and fungus that is naturally there to begin to overgrow. And that is a lot of time how SIFO takes over, small intestinal fungal overgrowth. So really important that we know that the main reason for it is antibiotic use. Now, it's often said in the literature, the medical literature, it's from antibiotic overuse. But even one 10-day dose, 7 to 10-day dose of antibiotics could cause fungal-based overgrowth. There's just no doubt about that. So keep that in mind. But another prevalent way, and I was also put on this drug as well for acid reflux, is a proton pump inhibitor. So if you're taking a PPI and you're reducing stomach acid, which hopefully keeps that fungus in check, lowers the pH, which is not a bad thing, it actually can allow for yeast and fungus to overgrow. Some people with higher levels of cortisol, that was me in my high school years for sure, or autoimmune issues can also suppress the immune system, which can lead to fungal-based overgrowth. If you have a diet overly high in sugar or refined carbohydrates, that's another way. If you're someone dealing with constipation, so you might have SIBO or you might have something already that can lead to fungal-based overgrowth. And then oftentimes food poisoning, or you get a bacteria from traveling, can lead to some fungal overgrowth as well, because it's an imbalance in the gut microbiome. So really important that you begin to understand that the bloating, the joint pain, these types of issues, people all the time say, well, the whole reason I cut out all carbohydrates is because I had joint pain, I had inflammation, I had autoimmune issues, I had skin rashes, and when I cut out all my carbs, they all went away. I say, sure, they did, because you shrunk the gut microbiome and you shrunk the yeast and fungus-based overgrowth. But that's not necessarily like you're literally, as they say, cutting off your nose to spite your face. Like that's not the best way to do it. And the reason is that your gut microbiome needs fiber. It needs fuel to be its healthiest environment, right? People can refute that, but the best longest standing data is that we do want that for overall health and longevity. So can we have the best of all worlds? Can we eat carbohydrates and then not get the joint pain, the inflammation, the bloating? Yes, if we fix the bacterial dysbiosis and we fix the SIFO, the small intestinal fungal overgrowth. And we can do that. So just to give you an example that it can be done, when I had an endoscopy when I was around 19 years old, so they basically put a camera down your throat. You swallow a camera down your throat. They found that I had yeast overgrowth all the way from my stomach up my esophagus onto my tongue. So I had massive yeast and fungal-based overgrowth. Part of it was being on the PPIs, but a lot of it was just taking 3 years of amoxicillin. Like that would just absolutely destroyed my immune system, and it destroyed my gut microbiome. So of course, what does conventional medicine want to do? Well, they want to put you on diflucan or nystatin. And I get it, I understand, because when you have a hammer and that's all you have, everything looks like a nail. So they have a pharmaceutical, they see a nail, that's their hammer, they just start whacking on it, right? And I get it. But the problem is you're not rebalancing the gut microbiome and you don't know why you got it in the first place. Now, had they stopped and said, why did you get this? Oh, it's all the antibiotics, right? Like that's a big part of it. And then you say, how do we repopulate? There was no discussion of that. Now, here's the thing. Most of the time when you do have SIBO or SIFO, you can't just add a probiotic. It's not enough. A lot of doctors try to do it. Again, I've tried all these things way back in the day, 20 years ago, 30 years ago. It doesn't work that way. Not when you have a bad case. So when you have a bad case, what you need to do is remove first. So you need to work on a specific protocol. But if you want to test, before we talk about the removal, let's talk about the testing. So the very best way to test to see if you do have fungal or yeast-based overgrowth is a test called the organic acids test, or also called the Candida metabolic and vitamins test. I can link that up today at stevencabral.com/3301. The second best way is a bacteria and parasite stool test. It's a 3-day test, not the best for looking for yeast, but decent. And if you have overgrowth, you're typically going to find it. All right. The third best way is a blood spot test, or you could do a blood test and actually looking for IgG markers for Candida. It won't tell you specifically if you had it versus you currently have it, but if you have all the symptoms and it shows high, well, it's a good bet that you have that as well. So there's just different ways of looking at it. The most comprehensive way, the easiest way, is the urine-based test, which is that Candida metabolic and vitamins test. Okay. So then if you do have it, what would you do? Well, I'm going to link up a podcast called the CBO protocol, Candida Bacteria Optimizing Protocol. Over 3,000 to 5,000 practitioners around the world use this with their patients and clients. We've been using it inside of my clinic for over a decade now, and it's really become so refined that it hit its final stage probably about 5 years ago and hasn't really changed since. And the reason is that it works. It is a 12-week protocol where you remove the yeast and fungal overgrowth, not completely, because we're not creating a sterile small intestine, right? We're just not creating a sterile environment. What we're doing is we're knocking the levels of yeast and fungus and bacteria, if we need to, down to a normal, healthy level. And then we're beginning to then repopulate the gut with specific probiotic strains that are meant for the small intestine to begin to repopulate. And then we will repopulate more of the colon-based bacteria as well, especially since it's coming through the mouth. And so when we do that, we're able to set in a balanced gut microbiome so that you don't need to do this then every single year. The goal is then just to maintain that healthy gut microbiome. Now, we've been doing this forever. This is also open source. So we share with you all the ingredients. So even if you don't want to use the EqualLife CBO protocol, we share with you exactly what to do. In month 1, this is the antimicrobial. This is the fluorofilm. So this is the biofilm disruptor that removes the biofilm that begins to protect a lot of these pathogens over time. It's one of the biggest reasons why this works so well for people. We talk about the Saccharomyces boulardii, the non-pathogenic form of yeast that pushes out the pathogenic forms of yeast. That is a product that everyone should be using if they ever have to go on an antibiotic. So it's a specific product called Clean Gut Probiotic. If you ever have to go on antibiotics, use the Clean Gut Probiotic plus the Healthy Gut Support so you don't get leaky gut, intestinal permeability, increased intestinal permeability. So again, we use Saccharomyces boulardii. We move into then a Lactobacillus acidophilus probiotic, and then we move into a full strain after that, walking you through the antimicrobial process so your body doesn't get used to just using caprylic acid or just oregano oil or just uva ursi or any of these. They're all great, but we use it in a way where we can work gentlest to strongest so you get the effects that you're looking for. And again, all of that's open source. I'll link it up here for you today at stephencabral.com/3301. And then the goal is also then to begin to slowly add in specific carbohydrates that then act as prebiotics that can then feed the good bacteria again, that can then begin to thrive. That is how we get people back to a normal, balanced diet, how we begin to reverse all of these health-based diseases, and it really starts with that gut microbiome. So if you've never heard about SIFO, small intestinal fungal overgrowth before, or SIBO, I invite you to either run that Big 3, the gut bundle, which is the food sensitivity test, the bacterial parasite stool test, and the Candida metabolic and vitamins test. Or if you just want to start with one, the simple urine-based test for ages 3 years old and up, begin with that Candida metabolic and vitamins test. It comes with a coaching call with your integrative health practitioner or your EqualLife coach, and that can really then set you up for the foundation of healing. So I wanted to give a quick overview of this. If you have any questions or I can help in any way, of course, just feel free to leave a comment on this post. And if you ever have a specific question, feel free to either leave it at stephencabral.com/askcabral or right at cabralsupportgroup.com, where we answer your questions every single day in our private Facebook support group. Thanks so much, everybody. Have an amazing rest of the day. I'll talk with you soon. Take care. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.